Good evening, ladies and gentlemen. My name is Robin McGrady, and welcome to my YouTube channel. Thank you for tuning in. If you tuned in last week, I defined what is diabetes. In the second video, I defined what is fiber and how that can be a weapon in your arsenal in fighting this dreaded disease. Now, today I'm going to talk about hemoglobin A1C, what that is, and why you should have your blood tested to see if you have either prediabetes or diabetes. Hemoglobin A1C is a blood test that should be performed in your doctor's office. For a diagnosis, you should have your blood drawn by a phlebotomist, a lady that draws labs, and you should have that done in, again, your provider's office. There's another way that this can be done is they can prick your finger and also determine your hemoglobin A1C. However, this is not a definitive diagnosis for pre-diabetes or diabetes. Now, there's some other tests I want to discuss that are not common in the literature, and I want to bring these tests up because they're important. But before I get into those tests, I want to talk about what are the numbers you can expect to have for if you have diabetes. So if you have pre-diabetes, your numbers are going to be between 5.7 and 6.4. If you have normal, that reading has to be below 5.7, and 6.5% or greater. Two separate tests is going to give you a diagnosis of diabetes. Now, what I also want to say about the hemoglobin A1C test is that it is done every 3 months. Every 3 months, once every 3 months, your cells your cells change, they grow, they die out. And so this is how the doctors look at the sugar that sticks to the red blood cells, and they can get an idea of how well you are tolerating glucose. Now, I also want to mention that there are 3 other blood tests that you can ask your physician to take. One is called a plasma fasting glucose test, FPG. The other is a oral glucose sugar test. You drink a sweet drink, and then they get the readings before and after. Okay, now the plasma fasting glucose test does require 8 hours of fasting before that test. And that's pretty much it. When you go to the hospital, what should you expect? A phlebotomist or a lab technician is going to draw your blood from your vein. And again, this is the accepted method for giving a definitive diagnosis of pre-diabetes or diabetes. Again, you can ask your primary physician for 3 other tests. And again, they are plasma fasting glucose tests, oral glucose tolerance tests before and after drinking a sweet drink. Okay, and then now I want you to click the link below because I have the charts of the numbers that when your doctor tells you either you do or you don't have diabetes, you can look at those numbers down in the link below. And I also want to say, please query, let me know if you have any questions as it relates to testing and how you feel about your diagnosis of diabetes. I'm going to talk about next week white coat syndrome and what that is and what that means. And basically, it's when people are afraid to go to the doctor due to the atrocities that occurred in healthcare with African Americans. You have a lot of people, and understandably so, afraid to trust medical providers. Now, click and subscribe. I'm going to talk about that next week. What is white coat syndrome? and how I want you to go and get yourself checked out in spite of having that fear. If you're not comfortable with your provider, you can request a different provider. You can even request an African American provider, because a lot of times African American providers do understand the nuances that are specific to black and brown people. So again, I'm trying to help people one person at a time. I want you to know what your hemoglobin A1C is, and understand how this test is important. Now, I do want to mention this. There is some controversy about the hemoglobin A1C out there, and as far as genetic mutations in some people. And while the American Diabetes Association does promote this test, there is some research that suggests that there are genetic mutations in the African American population that may sway these tests. So be mindful of that. When you go to your doctor, you want to get 3 tests. You want to get the hemoglobin A1C, you want to get a lipid panel, and you want to get a comprehensive metabolic panel. Okay, again, I'll be talking about next week white coat syndrome, and I'll be talking about those other 2 tests that you want to ask, which is the comprehensive metabolic panel, which is going to look at your cholesterol and your lipid, and these are the good and bad fats in your blood, which are a part of your total picture of how you metabolize or break down sugar for energy. Thanks for tuning in, family. Please click and subscribe. And again, I do have some links down below. Hit those links and they're going to give you, when you click it, you can get the numbers that I talked about for prediabetes, normal, prediabetes, and diabetes. Please share this video with someone. Peace to the family. Peace to you. Stay well. God bless.